Thank you, and it's really wonderful to be able to join you here this morning. Can I thank Uncle Tony Garvey for that lovely welcome to country, and I'd also like to acknowledge that we're on the lands of the Wurundjeri people, and I pay my respects to elders past and present, and honour all Aboriginal people who are with us here today. And I'd also like to recognise those with lived and living experience in the sector. You play an incredibly important role in the work that you all do each and every day. And of course, special thanks to the leadership of VAADA for putting on this incredibly important event, in particular President Dr Tamsin Short and CEO Chris Christoforou. For those of you here today, you understand better than most the unique and complex AOD challenges currently facing our communities. And while many of these challenges are familiar, there's no denying that there's new challenges rolling in thick and fast. Whether it's responding to growing demand for services or preparing for the threat of novel synthetic opioids, it's critical that our efforts to reduce AOD harms and improve outcomes relies on innovative, evidence-based and health-led solutions. Which brings me to the theme of this year's conference, which is so fitting: from challenges to solutions, responding to a changing world. This theme does prompt us all to reflect on the ways we've been doing things and ask what's working well, what can we build on, what's missing, and what could we do differently. And these are important questions because they help lead us towards innovative solutions. And while I do recognise there's a lot more work to be done, I'm very proud to be part of a government that supports innovative approaches to addressing and reducing AOD harms. Whether that's as the home of one of only 2 safe injecting facilities, not only in the country but the Southern Hemisphere, or our health-led response to public intoxication, we know that doing things differently leads to better outcomes. Of course, the most recent example of this has been the commencement of Victoria's drug checking services at Beyond the Valley and Hard Mission most recently. And I'm very happy that so far it's been a great success. So I'd like to take this opportunity today to specifically call out each and every worker who's been involved in the delivery of this service, as well as our fantastic partners. Youth Support and Advocacy Service, or YSAS, the Loop Australia, Harm Reduction Victoria, and Youth Projects, Royal Melbourne Hospital and Bio21 for their important supporting roles for this service. Alongside the Department of Health, these organisations and their workforce have worked day and night to seamlessly stand up this incredible service in record time. Over 700 young Victorians access the drug checking service at Beyond the Valley. That's the largest number of people at a single event anywhere in Australia. And because we know that people who use the service intended to talk with their peers, we know that the vital harm reduction messages and information has reached thousands more than that 700. For those of you interested in the numbers, here's just a few of the stats from Beyond the Valley. For 70% of those who used the service, it was the first time they'd ever had a conversation with a health professional about their drug use. 40% said they'd consume a smaller amount of drugs, and 1 in 6 intended to discard their drugs altogether as a result of the test results. As impressive as these figures are, I'm sure they're not surprising to any of you because we already know that drug checking works. We know that if we equip people with the facts, they can make safer and more informed choices. That's why our government has been very clear. We're conducting an implementation trial, not an efficacy trial. It's also why we're the only jurisdiction in the country to have dedicated legislation to enable the continued delivery of these services now and into the future. And it's why, under our government, drug checking is here to stay. This trial is about rigorously testing the model to make sure we can implement an ongoing service that best meets the needs of Victorians. So we're testing mobile services at big events, small events, metro and regional events, single day and multi-day events. And from the middle of this year, we'll open up a fixed site because we know that that's how we'll reach a much broader range of people if we have a fixed site and a mobile site model. Importantly, beyond the individual impacts, drug checking is also helping keep our whole community safer by providing valuable real-time intelligence to support our drug surveillance programs. In the context of the increasing evidence of the infiltration of dangerous synthetic opioids and nitazines in our drug market, this intelligence has never been more important. Really, at the heart of drug checking services is the unique opportunity to have a health-led, stigma-free conversation with people about their drug use. It's also providing us with the opportunity to have a bigger conversation with the wider community about the value of harm reduction and to think differently about drug policy. It's certainly been a very big year for the AOD sector. In just the last 12 months together, we've brought some incredibly important initiatives to life while continuing the delivery of our foundational AOD services and our systems, which support over 40,000 Victorians every year. One of the key priorities has been the implementation of our $95 million statewide action plan to reduce drug harms. And I'm happy to say that we are making excellent progress on the 11 initiatives that form part of the plan. Don't worry, I'm not going to go through all 11 with you right now, but I did want to call out a few important ones, including that we've appointed the state's first Chief Addiction Medicine Advisor, who many of you I know will know, Dr. Paul McCartney, and I think he's actually presenting at the conference, if not today, tomorrow. Paul does bring a wealth of clinical expertise into the Department of Health, and that's ensuring that those important perspectives help form part of our policy and decision making. He'll also chair the soon-to-be established Ministerial Advisory Group on AOD, so we can bring the diverse expertise from across the sector closer to government decision making. We've also expanded our AOD outreach services across the CBD and in Footscray and St Kilda. We've passed legislation to enable the delivery of 20 naloxone vending machines later this year, and design work is well underway for our $34 million community health hub in the CBD, which will host Victoria's first hydromorphone trial. And I'm also happy to report that brand new health, mental health and addiction services are now operating out of the Salvation Army site at the top of Burke Street. And I'll shortly be announcing an important expansion of pharmacotherapy services in our community health sector. Many of you will also be aware, and it's already been touched on this morning, that we've been working hard to develop Victoria's first AOD strategy. This is no simple task, as I'm sure all of you know who have contributed to the consultation so far. Victoria's AOD system is complex and its borders are a little fuzzy in places. In fact, I'm sure each of you would probably define the system differently if we did a straw poll right now. The complexity is partly what makes our strategy so important. The Victorian AOD strategy will set out a 10-year pathway to guide reform and investment and strengthen our publicly funded AOD service system so that it's best placed to meet the needs of Victorians not only now but into the future. The changes we need to see won't happen overnight, but there will be the need to continue to reflect, learn and adapt along the way. The strategy will help guide the way we continue to deliver our programs and services that are health-led, evidence-based and grounded in consumer-centred care. And it will point us to where there's more work to do and help lead us to new ideas and ways of doing things. This is particularly important, I think, in the context of new challenges, but equally important to ensure that we're able to keep pace with growing demand. In line with the conference theme, the strategy will help shift the dial from challenges to solutions. And a key focus will be improving system navigation, driving integration and increasing strategic partnerships across government, peak bodies, the sector and the community. This, I hope, will help us build a system with the consumer at its heart. One where we're supporting people to get the help they're seeking by removing barriers to accessing support. Cultural safety and cultural responsiveness will also be a key focus through collaboration with Aboriginal communities and Aboriginal community-controlled health organisations. The strategy will also help us strengthen partnerships with consumers and families that will inform policy, system design and service development. And it will prioritise the AOD workforce as a key pillar of the AOD system, providing us with a pathway to better support, develop and retain our wonderful expertise across the sector. And on that front, I do want to take the opportunity to acknowledge the skill and the dedication and the hard work of everyone across our AOD workforce. You do dedicate your professional lives to meeting the needs of consumers and their families by delivering high quality, integrated and person-centred care. And like health workforces across the world, the past couple of years have been particularly challenging. We've had workforce shortages and that creates additional challenges, and we're committed to addressing these through building a capable, supported and sustainable workforce, and that is a key focus of mine in developing the AOD statewide strategy. We already have a variety of initiatives in place for our workforce, including scholarships, relocation incentives, and the AOD strategy will really help us fine-tune and hone those supports to get the best for the sector. So before I close today and you get to hear from some of the outstanding keynote speakers that you've got this morning, I'd just like to thank you all. The work that you do is very complex and it's a very challenging environment. But the impact of your work is literally life-changing and in so many cases, life-saving. As I've said many times, our government is deeply committed to a health-led approach to reduce drug harm. This is a critical role of the AOD service system, and we're committed to ensuring the system is equipped to meet the needs of the community now and into the future. But we can't do that alone. The AOD sector, workforce and the community of consumers and families are invaluable partners, and our continued collaboration is the best way to ensure that we can reach our shared vision for the sector, but more importantly, for the people that rely on this sector. I really wish you all the best for today and tomorrow. I hope you really get a lot out of this conference. And again, thank you so much for the opportunity to speak with you today. Thank you.